Wellness. Our society spends much time and energy trying to achieve it. Exercising, eating right, and taking vitamins, all to help ensure a longer, healthier life. But are we doing enough? Millions of people suffer each day from an array of common complaints, including dizziness, chronic cough and indigestion, and accept these ailments as a part of life. Experts say these symptoms can often be linked to an undetected allergy. The symptoms associated with allergy can take many forms, all of which can be a detriment to long-term health. The key to true wellness, an accurate diagnosis.
A lot of times people are just covering up a symptom such as a cough with a cough suppressant, whereas the real problem is nasal in origin with drainage and pressure up above. And if you don't treat that, you're going to continue having symptoms. It's also important to have an accurate diagnosis, as the best treatment is avoidance, and you can't avoid what you don't know you're allergic to. Immunotherapy overall is important to know about because it's the only thing that's been shown to prevent progression of asthma and development of new sensitivities.
Other chronic complaints like fatigue, poor concentration, and depression are often related to the underlying conditions of sleep apnea, a potentially dangerous condition in which someone stops breathing many times throughout the night. According to the National Commission on Sleep Disorders, 1 in 6 Americans suffer from some degree of sleep apnea. If left untreated, it can lead to myriad health problems, including heart attack, stroke, and high blood pressure. Dr. Brown says if a patient's obstructive sleep apnea cannot be managed with a CPAP machine or jaw advancement appliances, sleep surgery is a viable alternative to clear the airway so the patient can breathe easy.
Managing sleep apnea is probably the most important thing somebody can do for managing their long-term health care risks besides smoking cessation. People that have sleep apnea, 50% have undiagnosed hypertension, 50% have type 2 diabetes, and markedly increased health care costs if they don't treat that over time. In appropriate selected patients, taking out tonsils, trimming the palate, which includes the uveal, and putting some stitches in to tighten up the airway, often clears their apnea and stops the need for the CPAP machine, which is often desirable, especially in younger patients.
Board certified by the American Board of Otalaryngology, a member of the American College of Surgeons, and a fellow of the American Academy of Otolaryngology, Dr. Brown is an ear, nose, and throat specialist with Iowa Head and Neck in Des Moines, a family-style practice providing personalized, friendly care and a comprehensive range of medical and surgical ENT services, including sleep surgery.
ENT has such a broad variety of cases, from airway emergencies in newborns to tonsils and tubes in pediatric populations to sinus and allergy problems in young adults, head and neck cancers and reconstruction in older adults, all the way up to hearing aids for the elderly. So in my opinion, it's important to be facile with all different facets of the ear, nose, and throat so we can provide the complete care for any patient that comes through the door.
To combat his patients' allergies, Dr. Brown often recommends allergy shots and this sublingual immunotherapy. Putting these safe, effective drops of allergen extracts under the tongue can decrease common allergy symptoms and often decrease medication usage.
It's exactly what the body is allergic to in low doses and slowly creeping up to a larger or environmental level. And the goal is to basically teach the body not to overreact to things that it's overreacted to in the past. Over 90% of patients are happy with the treatment they get with slit or allergy injections. It's incredibly safe. It's been used for decades in Europe, and we're increasing the use of it here in the United States.
This is another innovative treatment for chronic allergy symptoms, balloon sinuplasty, a minimally invasive approach to treating chronic sinusitis symptoms. Clinically proven to be safe and effective, Dr. Brown performs the procedure in his office with local anesthesia and consistently positive results.
It's similar to coronary angioplasty, where we pass a lighted guide wire into the sinus with a balloon passed over it. It's then inflated, causing a microfracture of the bone and an increased opening into the sinus, which improves ventilation and drainage. This new procedure is a lot less invasive, a lot less painful, and takes a lot less recovery than the conventional sinus surgery. There's no packing, often no pain medicines required, and the patients drive themselves to and from the appointment and are back to work the next morning in a normal fashion. With 40 million Americans suffering from sinusitis, 65% of those having incomplete resolution with their medical symptoms, there's a large portion of the population that would be amenable to this procedure.
I was having severe sinus infections. I was getting 8 or 9 a year. To the point where I was on antibiotics all the time. My asthma was flaring up. I was in the ER a couple times a year, and I knew that it was allergy related. So I needed to figure out what was going on, and I came in for allergy testing, and I was allergic to basically everything. I feel 100% better. There was a major difference in my health after 6 months, and there was a huge difference after about a year. If you're suffering from allergies and you're not sure what to do, I absolutely recommend coming and getting allergy tested. It's simple. It just takes a half a day out of your life, and they can determine, what you are allergic to, and they design your serum, specifically for you. And once you start those shots, it's such a major difference in your health.
My sleep apnea has improved a great deal, and Dr. Matt Brown has been very good with doing that. Tonsils, adenoids in the back of my throat were large. We made an adjustment there. We made an adjustment with a hyoid and a tongue advancement, which helped to keep the tongue away from the back of my throat. That has helped a great deal and allowed me to breathe quite better.
Patients are uniformly happy with the treatment algorithms that we use, especially with regard to the allergy, whether it's the sublingual treatments or the allergy injections. It's easy for them to do, decrease their health care costs and their medication usage, and overall their quality of life is improved.
I personally feel better, and I know that I'm in good hands, and I know Dr. Brown is doing everything possible to help me reach my goals.
There is no need to accept chronic ailments as just another part of life. Resolve to solve them. Let Dr. Brown and the staff at Iowa Head and Neck help you achieve your optimal health. For more information, go to ihnclinic.com or call the number on your screen.